Hello everyone, my name is Van Morris and I'm a Site Clerkship Director for Neurology at the GRU UGA Partnership. And I've been asked by the administration here to say a few words about the assessment for the third and fourth year medical students that is provided by the preceptors. First of all, I want to thank you all for participating as a clinical preceptor. What you're doing is very important for these young people, and these young people are very important to the people of the state of Georgia and to North Georgia in particular. Evaluation is a very important part of the clinical experience of medical students. It has many different uses. It's useful to them to provide feedback so that they can alter their behavior or their study habits. The GRU UGA Partnership utilizes an evaluative approach which applies at least 5 of these different kinds of ways of evaluating students. There are 16 of them, and we use at least 5 of them. We use a descriptive process. We utilize a rating scale. We utilize formal testing, both local and external, namely the shelf exam. And we also have a part of the evaluation that includes a portfolio, namely the patients that they've seen, the patient log, and the procedure logs that they keep. The part that most of you all will be associated with is the rating scale part. The rating scale that we are asked to fill out is worth about 50% of the patients of the student. The student's overall score depends in large part on how you score the student on the rating scale. The rating scale attempts to quantify certain qualities that people have determined are important in the making of a good physician. There are 5 overall qualities and behaviors that are looked at. Each one of these behaviors is differentially weighted depending on whether or not you're in the 3rd or the 4th year. And then under each of the 5 headings, there are several questions which have then multiple buttons outside that you can press. And it's a Likert scale that goes from not applicable to exemplary, and it's pretty self-explanatory what those ratings mean. It is very subjective, and that's a known critique of the rating scale system. But it's an attempt to try to quantitate things that are hard to quantitate. These scales are very important to the students. Their grades are very important to them, and we want them to if they have a problem with the grades, the outcome at the end of a clerkship, we want them to address the site clerkship director, me, but we don't really want them to come to you. The most important thing is that grading doesn't just occur on the last day. The most important thing is that grading begins the first day they come on the service. It's important, I think, at the beginning of each rotation for you to review the different behaviors and qualities that you're going to be asked to rate at the end of the period. Take notes if necessary, so that it'll help you remember at the end of the rotation. You're busy in your clinical practice. It's easy to forget these things. It's easy to forget the small details, especially the positive ones. And they are so dependent on getting those positive input and the negative input as well. The mid-rotation feedbacks are also vitally important because it allows the student to make a mid-course correction if necessary. So grading begins at the beginning, it continues throughout the course, and it finally ends up with the filling out of these forms. And the descriptive part of the rating scale is very important. It's included on the all-important Dean's letter, which is sent with each student as they go and look for residencies. I want to emphasize that the Clerkship Director's Office is open for your questions. If you have trouble, get in touch with Rachel McDaniel and Jeanette Bowman. Thank you.